Hello, my name is Dr. Praveen Sarda. I'm an orthopedic surgeon based in Ahmedabad, and today we are going to talk about shoulder replacements, some facts and some myths that are associated with it. So first of all, you need to know something about your shoulder. It is a ball and a socket joint, which means that it has a large ball and a shallow socket which is only about 1/3 of the circumference of the ball. This allows the shoulder to have a large amount of movement. However, because the shoulder then remains unstable, it is a very different type of ball and socket joint from other ones, say for example hip joint. And to maintain the stability, it relies on a group of muscles called the rotator cuff that help keep this ball centered in the socket when we move our shoulder. And this difference is important to understand, as you will know later during my talk. So let me answer the next question, which many patients commonly ask me: can the shoulders be actually replaced? Because everyone's heard of hip and knee replacements, but shoulder replacements are not that commonly done. So there is a myth that shoulders cannot be replaced, and if they are, the results are not good or complications can happen, etc., because it's a complex operation, which is true. It is a complex operation, but the answer to the first myth is that shoulders can be replaced, and quite successfully at that. The present generation of shoulder replacements has been in use since over 25 years, and there is the latest article on the survivorship of shoulder replacements in a reputed journal, The Lancet, which was published in 2020, and there's 94 to 95% survival rate of shoulder joints after 10 years. The next one is a myth comparable to hip and knee replacement. So again, I'll quote a research article from Johns Hopkins Institute in US. They looked at thousands of shoulder replacements, and they've concluded that done by experienced surgeons, the complication rate after shoulder replacement is no different than hip or a knee replacement. So the next question then is, why does the joint need to be replaced? Like other joints, the hip or the knee that you must have heard about, the commonest reason for shoulder replacement is osteoarthritis or rheumatoid arthritis, which in Gujarati is also called Sandiva or Gathia. Sometimes I also have to do primary shoulder replacement for a complex trauma like fracture, which cannot be fixed with conventional plates and screws. With worsening arthritis, the joint gets painful and stiff. Painkillers may not help anymore, and if it starts other problems like sleep disturbance, etc., then that is the time to consider surgery like shoulder replacement. So what is the procedure and what does it involve? Just like a hip or a knee replacement, the shoulder replacement, it changes the articular surface, that is the worn away bone. We take it out and replace it with medical grade metal and plastic. Generally, I do this procedure under general anesthesia, as in the patient is unconscious, and it is supplemented with a nerve block to help you cope with the pain after surgery. The primary aim of the surgery is to reduce the pain in your shoulders, and most patients also get an improvement in the range of movement after the surgery. There are two different types of shoulder replacement, and this is where it is different from hip and knee replacement. And if you remember my earlier statement about rotator cuff, this is the importance. So if your rotator cuff is intact, as in it is not torn, then you can have a conventional shoulder replacement where the ball replaces the ball and the socket replaces the worn out socket, and it is a normal looking joint. But if the rotator cuff is torn and is not functional, then we need to change the geometry. So the ball becomes the socket and the socket becomes the ball in the artificial joint, and this is to allow the other group of muscles to function and get movements in the shoulder joint, which will then replace the lost rotator cuff. The next question to answer is, what are the risks associated with this procedure? So like any other replacement, the standard risks of a joint replacement: infection, bleeding, nerve injury, clot, sometimes fracture, etc. But taken together, these risks account for less than 10%. So you're still looking at over 90% success rate with this operation. You normally stay in the hospital for about 3 to 4 days. The arm will be in a sling for about 6 weeks after surgery, and you will need a programmed physiotherapy protocol, for which I give my patients a printout and liaise with the local physiotherapist to help the patient out over a period of next 3 months or so. To get the full outcome after the surgery, you're looking at between 6 to 12 months, which is again the same as what you would for a knee replacement. So this was in brief a talk about shoulder replacements, and if you have any queries, feel free to get in touch with us.